Unprotected sex, the risks and dangers. Do you think unprotected sex is dangerous only when pregnancy is possible? Think again. One decision made in a moment can expose you to infections, unintended pregnancy, and consequences that may affect your health for years. What is unprotected sex? Unprotected sex means having vaginal, anal, or oral sex without appropriate protection such as a condom or without an effective contraceptive method where pregnancy is possible. And here's something important: you cannot always tell whether a sexual partner has an infection just by looking at them. The major hidden risk is chances of sexually transmitted infections. Unprotected sex can increase the risk of sexually transmitted infections, including HIV, gonorrhea, chlamydia, syphilis, hepatitis B, herpes and human papillomavirus, HPV. Some infections may cause symptoms, but others can remain silent. That means someone can have an STI, feel completely healthy, and still transmit it to another person. It's not just about HIV. Many people think only about HIV when they hear unprotected sex. But other STIs can also cause serious complications. Untreated infections can contribute to pelvic inflammatory disease, infertility, pregnancy complications, chronic pain, and certain cancers. For example, persistent infection with certain types of HPV can contribute to cervical cancer. And if pregnancy is possible, unprotected vaginal sex can also result in an unintended pregnancy. Contraception and condoms serve different purposes. Many contraceptive methods prevent pregnancy, but condoms also help reduce the transmission of many STIs. What if it already happened? You had unprotected sex. Don't panic, but don't ignore it either. Depending on what happened and how recently it occurred, there may be options such as emergency contraception and, for potential HIV exposure, post-exposure prophylaxis, PEP. PEP works best when started as soon as possible and must be started within 72 hours of a potential HIV exposure. The safest approach is simple. 1. Use condoms correctly and consistently. 2. Know your partner's STI status. 3. Get tested when appropriate. 4. Consider vaccination against hepatitis B and HPV where recommended. 5. Avoid making sexual health decisions based on assumptions. Unprotected sex may last only a few minutes. But an infection, unintended pregnancy, or its complications can last much longer. Protect yourself. Protect your partner. Protect your future. Think before the moment. Because sexual health is part of your overall health.
Use condoms consistently.
Fellow Dr. BC Life for more public health related topics. Bringing you health information that can make a difference.